Hi everyone, I'm Nancy. I'm at the Fort Belvoir Community Hospital Partial Hospitalization Program where we treat generally military population that's coming from inpatient at Fort Belvoir Community Hospital. Generally they've been through the addictions inpatient behavioral health clinic, and they come because of co-occurring disorders that they have with PTSD or adjustment disorder combined with some sort of addiction, alcohol or drugs. And I wanted to talk to you today about a patient that I have, and I'll just call him T. He is a 31-year-old married African American male. He works in the logistical supply department there on the Fort Belvoir compound. He's married. He has 5 children. He's been married for 7 years, and he has 3 stepchildren and 2 biological children with his wife of 7 years. So when T presented during the intake, he reported that in the past he felt like he was someone who really liked himself and was proud of his accomplishments, but that he had become someone that he didn't like, he didn't connect with, he isolated a lot, and he would push his family and friends away because he felt like they could get along better without him, and he had a hard time focusing on sobriety. He was an alcoholic. He had tried several times to quit drinking on his own, but had not, succeeded. And so it was kind of a crisis that brought him into the inpatient at Fort Belvoir. He hated to sleep at night because of the nightmares that he was having. So he had a pretty high level of stress due to his PTSD. He had been deployed twice to Afghanistan, both times, and he first started drinking in college, and he drank alcohol pretty regularly, and then after he came home from being deployed to Afghanistan in November 2012, his alcohol consumption really increased, and he observed and reported that he had a lot of mood swings, a lot of problems in his relationship with his wife, and suicidal ideations. Now, he had reported having one suicide attempt when he was 10 years old. But then, since then, he had no plans or gesturing towards committing suicide. But he had a lot of thoughts of how people in his life would be better off without him. So, he at intake T, he reported really having a lack of a social support system. His major problem that he felt that was going on currently was his relationship with his wife had gotten worse and worse over the years, and then when he started drinking very heavily, it got even worse, and they were living in separate parts of the house. He was living in the basement, and she was living upstairs in the master bedroom. And he spent most of his time when he wasn't working in supply. He was taking care of their kids, one of which is a 3-year-old, and he would get the kids dressed and ready for school and for daycare and take care of them, and that was his primary responsibility in the house. So when T reported for intake, he was determined to have Axis 1 alcohol dependence and major depression, which was recurrent, and then a lot of occupational stressors and family stressors. So he was put into combat trauma and then substance abuse tracks for our program. When I worked with him on his treatment plan and his setting objectives, he understood that he would have individual therapy with me 2 days a week, and that also he would have group therapy for the combat trauma and the substance abuse, and those we were conducting, every day, twice a day. So his objectives that we set together was to, completely abstain from use of alcohol and other drugs. He wasn't using any other substances, but so alcohol was his drug of choice. And he remained sober. He did not relapse during the entire 6 weeks that he was with us, and we are a 4 to 6 week program. But it was determined that he needed the extra 2 weeks to transition back to work and work on some coping skills. So his main goal was to remain abstinent, to learn coping skills in order to deal with the triggers for drinking, to process his combat trauma, and we did that in groups through narrative therapy and CBT, and to, most important was to come up with some ways to manage his relationship with his wife, possibly get his wife into therapy with him, and to build their relationship to the point where he felt like he could get his needs met at the same time while trying to address her needs and take care of the family. While he was in treatment, he consistently scored high on depression and basically the major stressors once he got his medication settled was the relationship with his wife. This was what was causing him the stress that really led to the depression, fed into his feelings of very low self-worth, and then caused him to be triggered to isolate and then to drink. So he showed very good insight into his condition, and he started to realize, of course, that he needed to reach out to others when he was feeling like he wanted to isolate. He needed a new set of peers to interact with, those that were in recovery or at least were sober, and he needed to start attending AA and find a support group that was going to really help him in his recovery. So during the time that he was in treatment with us at Co-Occurring, he did not report having any feelings of suicidal ideation. He did not present to be depressed on the level or having any sort of plan for committing suicide. My biggest fear with him was that he would isolate and then make the decision to drink, and then I think that would have been really devastating for him, and that any relapse might have resulted in some serious suicidal ideation. But one of the issues that I found with him in therapy was that he would sometimes leave groups and feel kind of overexposed by what he had shared with everyone, and then he would go home and isolate and decide not to go to an AA program. And one of our objectives was for him to attend AA meetings twice a week so that he could reach out to other recovering alcoholics, find a sponsor, and start working the steps to support his recovery once he was finished with our program. So about midway through his treatment, in week 3 of the program, T came into my office and he had a bottle of rum with him, And apparently what had happened is that the night before he had gotten into a really extreme volatile conflict with his wife, and she had as has happened in the past, he explained that she hauled off and hit him repeatedly in the face. And so when he came in, it was apparent that someone had been, that his face was kind of battered. He had one place below his eye here where he was cut, and he had apparently been in a fight. And so we talked about it, and he reported that in the past that she would become very aggressive and angry and would start swinging at him, and he would just let her hit him without responding. So he had never tried to report her to any agency. He had never gone to the family advocacy program that they have at Fort Belvoir, and he said that it didn't happen in front of the children. The children were never involved, but clearly there was a level of violence and inability to communicate effectively in the house that was very stressful for him. So what had happened then is that after they had their huge argument, he had gotten into the car and he drove over to the military exchange, and he walked through the store and he bought a bottle of rum, and he got back in his car and he decided not to open it, and he took it home, put it in his closet, didn't drink for the night. And the next day, he put the bottle into his backpack, and he brought it into our unit and turned it in to me there at the office. I was very surprised that he had taken this chance on bringing the bottle into the office, and that he didn't just take it and throw it into a dumpster or something along the way to work. That he would bring it into the office really made me wonder if he was trying to send us the message that he was in a horrible situation and he really needed help, and that the chance of relapse and possibly committed suicide was very high. So this was kind of scary to me, and I questioned him on why he would have brought it into the office rather than throwing it away, but ultimately, he explained that he was getting close to graduation from our program, and that he was terrified of not having the support that he had with us, and he was terrified of trying to work the program alone and not having kind of a lag in therapy. And me and my supervisor explained to him that he would not just be dropped, that there would be that there's a safety net for him. He would go into the alcohol and substance abuse program with the Army, and that we would have a social worker meeting with him, once a week to address all of the objectives that he was working on in his treatment plan. But that did seem to help some, but I was very concerned about this relationship with his wife, in that he would show up for therapy and ask me to write down questions that he could ask her, like a way of just kind of opening the conversation with her, because they had become so removed from each other, and physically in the house they were living on two separate levels, and they just had very, very little communication, and that had broken down to the point where he didn't even think that he could open a conversation with her. So what I wanted to know from you is if anyone had a kind of similar situation where the husband and wife had become so isolated from each other to where they could absolutely not communicate, and how you advised one of the parties to open discussion, especially if they were not going to go into therapy together, because she had refused.